We can't start early.
3:59.
Well, welcome to the Indian River County Hospital District's regular monthly meeting here in the Commissioners' Chambers room. We're going to start first with an invocation from Frank Isley, our Executive Director.
Happy to. If everyone could just bow their heads, please. Gracious and loving God, we thank you for the opportunity to gather in service of our community today. As trustees and staff of the Indian River County Hospital District, we carry a sacred responsibility to protect the health and well-being of our neighbors, especially those who are vulnerable and in need. Grant us wisdom in our discussions, compassion in our decisions, and clarity in our purpose. Help us to steward the resources entrusted to us with integrity and listen with open hearts to the voices of those we serve. May our actions be guided by fairness, humility, and a genuine desire to bring healing and hope. Bless the providers, caregivers, and community partners who work tirelessly each day to deliver care. And bless our residents. May they find the strength, dignity, and peace in systems of support we strive to build. We ask for unity in our work and courage to face the challenges ahead with faith and resolve. Amen.
Amen.
Thank you very much, Frank.
Liberty and justice.
Our first item of business is to approve the minutes from the May 8th special meeting and subsequently meetings that followed on May 14th.
Oh, wait, you were also disbursement, sorry.
And, yes, and we have to say, the reason we have to approve the disbursements for our Treasurer Michael Kent. Is there any comments related to the minutes? I just have one. On the chairman's notation on May 14th, it says that the chair informed the board not to be overly solicitous of Indian River Hospital leadership. That's not what I meant. What I meant was that we should speak with one voice through our Executive Director, Frank Isley, rather than multiple voices. A trustee, of course, can visit with anyone on the Cleveland Clinic staff at any time as per their prerogative or need. So with that, that's the only notation which I have. Is there any others?
I just a typo thing. The last page of the May 15th minutes, in the next to last paragraph, it talks about Mr. Deagle.
Thank you for catching that, I appreciate that, Michael. Even I missed that.
Very good, we'll make that correction. So do we have an assistant secretary here? Very good, okay. Okay, and I also thought and would ask Frank if he would once again introduce our staff who really worked hard in getting our budgetary process together. And we haven't approved, oh, sorry, thank
And the
you.
disbursement.
Okay, I thought we did that, but all those in favor of the minutes as presented and corrected?
Aye.
Those opposed? And all those in favor of the disbursement of $1,415,750.04, say aye.
Aye.
Approved. Thank you very much, Karen, keeping me on track here. Okay, now, Frank.
Sure. Thank you, Mr. Chair. As I mentioned in the past, we have a small but mighty staff with a new addition, Shannon Cox, who joined us 2 months ago. But they each have a role, and we work very closely together to serve the community, very closely with the trustees to meet the needs of the district and the community we serve. This year, obviously, we're doing a lot of things. We're adding a lot of new processes and putting some new things in place that we haven't done before, which has taken quite a bit of work, and I really am grateful to our team. And this meeting and going forward, I've asked them to report out and give regular updates, relative to some of the work that they do that I think will be helpful for the trustees to know, get some progress updates, but also to share with the public. So just starting, if we go down the line, Dawn Carboni. Dawn is handles our compliance and audit. Jennifer Frederick, who's our most senior. You're more than Kate by, 2 months?
No, Kate is actually
Oh, all right.
senior to me by 4 months, not age, just
I-
tenure.
And I will say, I'm also blessed to say, and again, I tip my hat to Anne Marie Suriano, my predecessor, who was here for quite a long time, who hired several of our team members who are here, and I'm very grateful to have them here. And longevity, Kate Voss and Jenny. Kate left for vacation, but Kate and Jenny, both here for over 10 years. And then we have Dawn, who's been here for several years, Caitlin, myself, and then our newest newcomer here, Shannon Cox. But so we've got Jenny Frederick, who runs all our programs, Shannon Cox, who is our newest addition, who handles our finance and program support specialist, working with Jenny and Dawn and our team. And we have Caitlin Dickens, who handles marketing items, data items, analysis items. And Kate Voss, of course, who's not here. And Kate's been with the district the longest, and my gosh, I've learned a lot from her in a very short time. Very grateful for this team. So thank you all.
Thank you all very much.
So they'll report out a little bit later on in the meeting and give some updates.
Excellent. Also note, looking over the agenda, if anyone has any conflict of interest, now is the time to please state that. Hearing none, we'll proceed with our agenda. District Council report, Jennifer Peschke.
All right, thank you, Mr. Chair. I've got the conflict of interest forms here, which we'll have each meeting in the event we need them. And so that was the first item on my report. I just wanted to let everyone know, the trustees, that we'll have the Form 8B, which is a statutory memorandum of voting conflict, in the actual packets each month and available, so that there's no concern about that if it's needed. We've also discussed including with each meeting packet for ease of use, that form, in accordance with our conflict of interest policy, which you recently approved. We've also added to our meeting packets each meeting, for public viewing or participation, our attorney's overview that's included. This is long, but it does contain a very good summary of our practices and procedures in conducting district public meetings, and also sets out the parameters for public comment. So I would urge those in the public who wish to make public comment to review this item in our meeting packet, so you're apprised of our practices for calling for and listening to public comment. I won't read the entire attorney's overview at each meeting unless we determine it to be necessary, but it is there in the packet as a resource for yourselves as well as the members of the public. And as I do each month, I continue to review the annual deadlines and deliverables due to the district under the lease with Indian River Cleveland Clinic, and will respond and report on questions and issues related to that as they arise. This past month, I've continued to work with district staff to review some of our internal policies to ensure they're up to date and compliant with current laws for the board, and we've been working to prepare a draft RFP and procurement policy for the board's adoption. There may also be some work coming forward from staff with regard to an LOI, which we heard a little bit about yesterday, and a template for that. As we incorporate these policies internally, I'm also keeping a running list of items that need to track back to a future bylaws amendment, so our documents stay consistent within. I've also reviewed the EC Impact Portal. I wanted to review that briefly because I wanted to see what you are all seeing as you're going through this process. I certainly haven't spent not even close to the amount of time that any of you have as trustees to review and rank the programs and do the budget work that you're doing. But I wanted to see what you're seeing so that I could understand how it's presented to you, since this is a new format for us, and really understand the hard work that the district staff has put into uploading, reviewing, and summarizing the funded agency requests for this budget funding cycle that we're in. I've also been working to keep updated on VCOM acquiring the space at the Human Service Building following their accreditation matters we've been discussing, and have presented Frank with some changes to the lease that the parties need to consider. We're not ready to take action on that yet, but that'll be coming forward probably in the next month or so for your review and consideration. Any questions? I'd be happy to take those at this time.
Okay, well, thank you very much, Jennifer, for a very succinct but useful report. And I do think it's helpful to have your overview presented so not only the trustees but guests on Zoom or in person know what our rules and regulations are. Okay, moving on, Michael Kent with our Treasury report.
Thank you, Mr. Chairman. Excuse me. In reviewing the hospital district's financial position, 2/3 into fiscal year 24-25, I am very happy to report that the district's financial situation continues to be very strong. For our review, as usual, I'll ask you to please turn to the last 4 pages of the May financial packet that you received. And we'll start 4 pages from the end with the district's investment and cash snapshot. Please note at the top that at the end of May, the district had received $20,785,005 of our anticipated ad valorem taxes. That's 98.3% of what is budgeted. And actually, the outstanding collections in this year's budget we anticipate are $365,657. Section 1 of this report details our U.S. Treasury holdings, which totaled $8,092,985 on May 31st. Those T-bills, as always, are staggered monthly through September, and they are in that last month providing us an interest rate on the average of 4.29%. Section 2 details our holdings in the preferred deposit pool, which is the money market account. And you see that at the end of last month, it held $6,074,485. It too was earning 4.29% in interest. And then Section 3 shows the district's local operating account at Seacoast Bank, which was holding $650,101 at the end of last month. Altogether, 8 months into the year, the district's investment and cash holdings totaled $14,817,571. And it also shows that at the very, very bottom, that 90% of all of the district's cash is invested for growth until we draw down, which we are now doing. We're not getting money coming in from Wesley Davis anymore. The tax collectors got a little bit, and it'll dribble in, but we're drawing now on those earnings on those taxes that we've had. The next and last 3 pages is the year-to-date expenses versus budget spreadsheet. If evenly expended over a period of 8 months, all distribution of expenses for our community agencies and programs would be at 66.7% of budget. As you scan through the programs, I don't think you'll find many significant deviations, and when you do, they're going to be programs that we have talked about over the past few months. However, if you have any questions, please do not hesitate to ask. The one that probably stands out the most, I think, is Thrive, who's only at 50%, because they every 3 months, so they're going to be dropping now to get caught up. The others are range more closely, and if they're over, we've talked about them. On the middle of that last page, you'll see that the total for all program expenses through May, was $12,072,821, which is 63.87% of the approved total program budget. The bottom half of that last page shows the district's administrative expenses, and you can see that total expenses through 8 months there totaled $835,747, and that's 62.65% of the approved budget. And combined, total program and admin expenses totaled $568, which is 63.79% of the budget. So we're under both administratively and programmatically, and certainly as combined. As a point of comparison to this year's 63.79%, a year ago, our expenditures were at 65.09%. Mr. Chairman, that concludes my report, but I would be happy to answer any questions, if I can, that the trustees might have.
Any questions for our treasurer, Mr. Kent? I just have, when is the exact date our fiscal year ends?
We're October 1 through September 30.
September 30th,
Yeah. So we're 8 months in now.
right at 8 months, good. Okay, let's then move along, unless there's oh, yes, sorry, Dr. Mackett.
Yeah, Mr. Chairman. Trustee Kent, thank you for answering that question about Thrive. And I also saw that the We Care program had no expenditures listed.
If I may, I can explain that. They also submit quarterly for their invoicing. However, the last quarter, we had some trouble reconciling. It was during the transition between when Ms. Jones was leaving and Vicki Soleil was taking over. So we're looking at that, and actually, we have a meeting next week to go over it to reconcile the invoice so that we can make payment.
Okay, thank you, Jennifer. And then on page 2 of the P&L,
Yes.
I was looking at the whole family expenses, and it looked like this might be a categorization problem either on our end or their end, where there was budgeted funds for the pharmacy prescription assistance, but no funds expended, and then no money budgeted for the medication assistance, but then 176,000 expended.
Yeah, that's actually at the bottom of page 1 if everybody's looking. And that literally was a case where we had specifically given approval to program names. And what happened was, the one with $0, I'm sorry. The medication assist, I'm losing my place. Right, medication assistance that had dollars budgeted but has expended none, really was pharmacy RX assistance. It's a matter of, and it's honestly, it's something I pointed out early on, and we've just never cleaned it up. And you're the first person who's actually looked at it carefully enough to ask that question.
It's an allocation.
I thought it
It's
was
just-
just,
Allocation matter, which we'll
Yeah.
address.
Yeah. And I'll say this, because we have somebody who's taking their time and really looking through it. If you actually look at the financials ahead of my summary, and you look at admin, the number that it totals there is about $28,000 more than what's in my report. I've talked to Kate. I noticed it for the first time. It was slightly off last month, and I've cross-checked the program expenses, the admin expenses. They all tick to what my number are. Somewhere, I think there's a number that's being grabbed. She knows what that number was last month and this month, and she's going to sit down with Frank and Dawn, I think, and they're going to try to figure out. It's fairly de minimis. It's not a big number, but it doesn't match exactly. And since you've got an eagle eye, I thought I'd go ahead and mention it.
appreciate it. Then this is more almost a philosophical question for you and Frank. When do we anticipate starting to book depreciation for the building on 10th Street?
Oh, that is, I don't have an answer for you now, but it's a good question. We are, I will say that, we plan to meet, and Kate hasn't set it up yet, but with Michael DeSalvo, a few of our staff, to address some of these still outstanding reconciliation issues, allocations and others, and we will address that at that time.
Okay.
Okay.
Thank you. That's all I had, Mr. Chairman.
Okay, thank you. Moving on to our executive director report. Mr. Heisey.
Thank you, Mr. Chair. So I'd like to take a few minutes just to update everyone on a few areas that reflect our growing efforts to strengthen our partnerships, diversify funding, and advocate for legislative change. First, I want to start with grants. So we've recently engaged Jordan Flick to prepare a 90-day grant research report with a strong emphasis on federal grant opportunities. I've been talking about this for some time, but we're actually going to we're actually engaged Jordan to go after the opportunities relative to special districts, which I think will be to help us determine what federal funding we can use our status as an independent special district to draw down into our county. So the goal is to see what we can do to bring in non-local tax-based revenue sources that complement and do not compete with our community partners. So these are going to be dollars in addition to. The final report is expected in August, which will provide a comprehensive overview of state, federal, and some other grant opportunities. Our goal is to bring additional federal dollars into our county to support health and healthcare access and infrastructure. Second item is legislative efforts. So at the federal level, the Special District Fairness and Accessibility Act, which is H.R. 2766, is gaining traction. If passed, it would establish a formal definition, now this is at the federal level, a formal definition of special districts and require all federal agencies to treat districts like ours as local governments eligible for federal financial assistance. This would eliminate longstanding barrier that's prevented independent hospital districts from accessing major federal grant programs. Now, this is different than what I just mentioned. This is going after specific federal aid through agencies like HHS, FEMA, and USDA. In addition, we've sent letters in support of healthcare advocacy and legislative collaboration to each of the 37 committee members on the Florida House Select Committee on Property Taxes. In addition to that, we met with Congressman Mike Herodopoulos at the Gifford Health Center to discuss the threat of federal funding cuts and how those will impact our community. We shared that many of our local providers are increasingly anxious about the uncertainty of key healthcare programs and those dollars. Mr. Herodopoulos was supportive and asked for specific examples, which we reached out to all our community partners, and we did get those, which we've since compiled and sent to the District Director, Pam Percy. And I also just asked for his perspective on what he thinks the role of independent special districts are, healthcare districts, and if he feels they're beneficial to communities. And he said the same, and he reaffirmed the support for our model and mission is solving our local healthcare problems locally. Last item is, does not have to be complex, so I want to walk through it briefly, but there's a 2-page attachment in the packet. This has to do with low-income pool and county share of Medicaid. This is how we, as an independent special district, draw down substantial federal dollars by contributing to these programs. So each year, and you notice when we were just looking at the whole family, we looked at the whole family budget, and you saw that there was a large variance there. That would be the same for TCCH because we just sent the low-income pool payments out last month. So these two mechanisms that we use to draw down federal dollars are the low-income pool and the county share of Medicaid. In FY24, we contributed a total of $550,000 to LIP and $594,000 towards the Medicaid share at Cleveland Clinic Indian River Hospital. These local investments helped draw down more than $1.5 million in federal funding. Now, the county share of Medicaid is not optional, but LIP funding is. And so whoever put that in place with the district at whatever time, that was a smart move because that's a program that we're looking at opportunities right now to expand on. There's other opportunities to maximize LIP by partnering with other Medicaid-enrolled providers, hospitals, or FQHCs, even to a greater extent, behavioral health providers and affiliated medical school practices that serve the population that is our target population to serve. So I don't have any more details on specifically what those opportunities are, but if we could use our dollars that we're already funding and draw down federal dollars into the county, that's a win. So I'm going to stop there, Mr. Chairman, see if there's any questions, and then I will go to the staff for some updates.
Any questions for our Executive Director? Yes.
Yeah, Mr. Chairman, just a comment. Thank you, Frank, for that update. Being able to get those intergovernmental transfers is key for drawing down those dollars, and I commend you and the staff for continuing to work on that. And thank you again, and to the staff for engaging our legislative representatives on our behalf for getting fairness for the special districts.
Very good. Yes, Michael?
Is the state organization for special districts tracking the United States House bill? Or are we,
Are they tracking it? They are. I don't have, I mean, there are a local resource for all information related to, National Special District Association, and the state of Florida. But I just, there's a lot of uncertainty in our community right now by our nonprofits, and, everyone's kind of in a wait-and-see mode. But I still want to move forward with what we're doing in terms of exploring the federal grant opportunities, seeing if we could be recognized on a federal level. So whether that happens or not, I'm not certain, but I want to make sure we're there and positioned to jump on it when we can.
right, excellent.
I had a question, Frank. When the district was involved in actually managing a hospital before 2018, I assumed that LIP was still present then, even though we were giving substantial dollars for indigent care. So was the origin of this, as you've noted, in 2005? And how has it progressed over the last 10, 15 years?
Yeah, Mr. Chair, I can't speak to the history. That I don't know. I'd be more than happy to look into that. Going forward, though, after everything we've researched, and Shannon and the team helped with that, I think there's other opportunity. So we can take the existing dollars that we're funding and bring in more federal dollars. I mean, it's just such a win. It's leveraged.
Good. Thank you very much.
Thank
That
you.
was very informative.
Thank you. So I'd like to just talk to have our team give some updates this meeting and in our future meetings, starting with Dawn Carboni. Dawn, do you have anything to speak on relative? Thank you.
Yes, thank you. I hope everybody could hear me. It's working, okay. So good afternoon, trustees. I wanted to just give a little bit of an update about what I've been working on. I'm sure you have all seen my recent emails over the last couple of weeks. I have completed and submitted audit reports for Dynamic Life, Thrive, and Sunshine Physical Therapy. I know that I have received some comments and questions from some of you, and we're working through those. And I am very pleased to say I am currently working on the final audit of the 22-23 fiscal year for TCCH. So I see that forthcoming in the next maybe 4 to 6 weeks. And I did want to let you all know that when there are recommendations in my audit reports, that each agency is required to submit a corrective action plan, and there is a due date for that. And then Shannon and I are following up with agencies just to make sure we're getting the corrective action plans in, and any changes to any policies or procedures are also coming in by the deadlines given to each agency. So I just kind of wanted to expand a little bit more so you all know, what our follow-up is on that process. I also wanted to talk about some of the things that Shannon and I have been working on, considering she is the newest employee that was added to our team. We have been reviewing the audit processes. She's helped me work on the completed audits. She actually proofreads everything for me before it goes out to agencies and before it comes out to the trustees. We're also working on compliance matters and the corrective action plans, and she has been a huge asset with assisting me to revise the audit schedules, the forms, and planning for our upcoming audit year to look at fiscal year 23-24. As far as policies, we have worked on developing a very comprehensive purchasing and procurement policy, and a fraud and false claims policy. Both of those will go to our finance committee for review next month. And then once they review and, kind of give their okay, or we make any adjustments that they think we may need, that will come to this board, obviously, for final approval. And we are also working on revising and updating our internal audit policy, so we make sure that we have very relevant information in there. And we are creating a cybersecurity and ransomware policy as well. In addition, I have continued to work with our team and our funding agencies on all of the funding applications that were submitted for the 25-26 budget year, and also working with all of the trustees and answering questions and providing information as needed. So I'm always at your service and happy to answer any questions that any of you may have.
Thank you very much.
Thank you.
Very nice report.
Thank you, Don. Jenny?
Okay. I'd just like to give you a little bit of history on the funding, the request for funding application process for not only you, but for anyone in the audience or on Zoom. So this is the second year that the district has utilized the EC Impact platform to solicit funding applications. While last year marked a significant change in our process, this year we aimed for a more targeted approach to align closely with the goals and objectives of the district that were set by you, the trustees, during your strategic planning meetings. We not only refined our areas of focus, but also improved our guidelines to enhance compliance, accountability, and stewardship of taxpayer funds. In February, the district invited community partners to attend one of 2 workshops where they could learn about the district's strategy, alignment goals, and the fee-for-service per encounter structure that we were moving toward. The deadline for community partners to submit their funding applications and supporting documents was March 28th, which at that time, district staff began reviewing the 59 programs from the 21 community partners. As Dawn mentioned, in addition to all of her other duties, she has sat with Frank and I daily to review each application, and in many cases, going back to the funded agencies and requesting additional information to support their budgets or their application to accurately determine the fee-for-service structure rate based on the costs associated with each program. Additionally, we asked the directors of finance to break down their budgets to meet the same requirements. So we were going back and forth, and it was taking, much time for all of us. This information gathered was compiled into a worksheet and with funding recommendations that we made based on historical, current, and future requests to the district. As Frank mentioned yesterday in the chairman's meeting, we introduced a new degree of alignment and impact framework. This framework organizes programs into categories based on their connection to direct care delivery and our strategic priorities. We found this challenging as we sometimes shared different perceptions, but we discussed it thoughtfully and thoroughly to come up with the best alignment possible. In looking at the evaluations from the trustees, I see that there are some different perceptions on degrees as well, which will be challenging to come up with one degree. But recently, during our individual meetings with trustees to check in on their evaluation experience, we identified other areas where we needed to dig a little deeper into the programs, the budgets, and answer questions that you may have had. So we've spent time over the past week or so doing that with the executive director, CEOs, and to request the additional information, and we'll get that information to you as quickly as possible. Let's see, what else? So now we're at the process where we're taking the information, we're analyzing it, and we will have by next Friday a detailed report for you so that we can further discuss these, the recommendations and and your recommendations, basically. I would like to say that it is officially closed. I think yesterday I said that we had, there was one that remained in process, so it is officially closed as of today, so we're good. Okay.
Thank you.
Thank you very much, Jenny. Caitlin, now for a visual.
Yes.
Some interesting visuals. Are you going to be able to put that up? Okay.
Yeah, I'll be able to pull it up. So I know last meeting, you guys talked about wanting to see some more of the data, so I brought some today. Let me see if I can share the screen. Okay, so I'm gonna start with the original dashboard. Most of the things don't change on a month-to-month basis since it's data that we get that's only updated maybe annually or every couple years. But there are a couple pages that do get updated every month, specifically the last 3. So every month I'm updating how many visits we're getting every month. So everything is broken out by the type of service, the agency, as well as little slicers. So you can look at just this fiscal year if you want to. And you can see the trends over time, as well as what agencies having the most visits, as well as you can specifically look at just one service too, if you would like. And I do want to say that this year, it's only, I want to say 8 or 9 agencies that are fee-for-service currently. Starting next year, since everyone is going to be fee-for-service, this is probably going to look a little different because it's going to obviously have a huge spike because it's going to go from 8 or 9 agencies to 20-something agencies. So I'm probably going to redo this a little bit for next year just so that it doesn't look kind of crazy, like we had a crazy spike. So that is the one that I'm updating monthly. And then this is another one. This is the portal data. So currently we have 4,400 active people in our financial assistance portal. It's currently trending up at a pretty aggressive rate. Month over month, just from last month, it was a 2% increase. So far this fiscal year, we've already increased by 8.74%. And I have down here a projection graph to see what the estimated numbers are. And by the end of this fiscal year, we should have an 11.8% growth, which is considerably more than last year, which was only 8.8%. So we're definitely seeing a big increase month over month of people who are signing up for our financial assistance. And I have graphed on here how Medicaid enrollment for our county is trending down pretty much like neck and neck at the same rate. So I would assume that's the cause of a lot of it. As people are getting off of Medicaid, they're coming onto our program. So that'll be interesting to see over time how that's gonna start increasing. We do have, this is the demographic breakdown of the portal. It automatically updates based off of the monthly snapshot that I put into it. Generally, things don't change a whole lot. I think the demographics have pretty much stayed consistent, but that will automatically update month over month. But then the other thing I wanted to show you guys is that I created a dashboard just for our annual health survey. So now all of our survey data is going to be in interactive charts. So we have everything, there's 4 different pages, as well as slicers for demographics. So if you want to see how people, sorry, this is loading, 18 to 34 answered the survey, or 35 to 49, you can see those. You can mix and match too. You can pick 35 to 49 and Hispanic. So you can break down all of the demographics and see what the different trends are. So on the first page, I have the overall satisfaction rates, so overall satisfaction with healthcare, as well as affordability, availability, and then people's opinions on the quality of the healthcare in our county, and then how they feel the choice of doctors, as well as the choice in dentists are. The second page is all the questions we had that were about access or the cost of care and healthcare in our county. So prescriptions, how they feel if they can get an appointment with a specialist, if they feel like they can get an appointment with urgent care. And then the 18.8% of people in our county felt like they had to go to the ER because they couldn't get an appointment with a doctor, which obviously we want to see next year, year over year, that number going down. And then their opinions on the availability of healthcare appointments as well as dental appointments. We want to see that improving year over year as well as there's more availability in the county. And again, all of these pages are going to be able to be broken down by different categories. So if you want to see people that don't have insurance, how they answered all of these as well, everything is going to automatically adjust so you can see.
I just want to interject for a second. So to produce this report, Caitlin had to build in a massive amount of data that we received back from the survey that wasn't included in the summary pages that we all saw, but to make sure that was, she was able to build that in interactive. Now that we have this baseline data, this is our baseline.
Yeah.
Excuse me, remind me, how many people responded to that survey, please?
It is, I believe it was 601. They had 601. It's small, but it's statistically
But it was
significant.
Exactly.
So
That was-
they match the demographics of the survey with the demographics of the county. That way we're getting a snapshot of what the county actually looks
Male,
like.
female, ages, demographic.
Yeah, they were using like the
in terms
census
of
data to
location,
make
yeah.
sure it's the same.
It was statistically significant. That's one of the reasons that we,
Yeah.
hired them.
And so we have a page that shows how much people are using the services in our county. So again, 19.3% of people said they didn't have a primary care physician, so we're gonna wanna
Caitlin,
see
Dr.
that.
Mackett has a question.
Yes, sorry.
Yeah, thank you, Caitlin. This is excellent. Just a comment on chartsmanship. So on satisfaction and agree, disagree, most people would look at agree or satisfied to be green as opposed to red, the opposite. So
Yeah.
I would just suggest changing those colors, because if someone just looks at that quickly, they might think, oh, boy, no one's satisfied.
Add number.
Yeah, I can do that. I did try, I pulled all of the colors in this from our logo, so everything is matched with our logo colors, and the program does kind of automatically just populate a color, but I can very easily switch that around, so.
All right, thank you.
So yeah, we've got how often are residents using different services? Behavioral health is the one I think that we talked about that stuck out the most. At only 14% of people said that they use a behavioral health or mental health service at least once a year. Some people less, but yeah, and 83% said rarely or never have they ever used a behavioral health service. And then lastly, this page, might take a second to load, is a really fun feature that this program has. It uses AI to find different connections and influences in the data. So you can select which question you want to look at. So we're just, question 1 is generally, are you satisfied? And then you can select what the answer was. So we've got somewhat satisfied. And it will show the different influences. So people that had Medicaid were more likely to say somewhat satisfied. People that were Black or African American were 1.5 times more likely to say somewhat satisfied. And so this will automatically populate based off of the data, and it's using AI to figure all that out. And so it's pretty in-depth because you can do every single question with every single response. So it's more of for you if you want to go in and look to be able to use it. But I thought it was pretty interesting because it can pull some information that we might not be able to see ourselves with the AI. So, oh, I do want to say some of them don't always have data if the amount of people that reply, there was not enough data for it to populate. But I would say probably 75 to 85% will give a chart on there. But so it is auto-generated.
What part of this is on, I know you have something on the website. Is this something that we can access?
So this one isn't on the website yet because I literally just finished it today. So it will be going on the website. I'll be working on that. But the original dashboard that I created is on the website currently.
So anyone could go on the
Anyone
website
can go and
pull
look.
this up and take a look?
Yep.
So thank you, Caitlin, for what you're doing here.
Yeah.
As kind of a data geek, it's fun to kind of look at this, but also very educational. So there are a couple things that popped out at me. I wonder if you could go back to use of services.
Yep.
And I think you had something there, 86.4% of residents had a checkup in the last 12 months. Now, I assume that's representative of all the residents of the county, or is it just our 4,400 people?
So this is from the survey that we did, so it was the 601 responses, so
But that's representative, not of the 4,400.
Mhm, that would be of the whole county rather than just
So
the
do you
people that
have
were
it
receiving.
based on the 4,400 that we have in the database?
We should be able to, because we're getting monthly invoices to know who is going. I would assume realistically, they're all going at least once, because they have, when they go to sign up or renew, they're generally going because they have an appointment. So they go, they have an appointment, they show up and they fill out an application. But we could look and see how often people are going, at least for the I want to say it's 6 agencies that currently use the portal, because not all of the agencies use the portal.
Well, personally, I'd be curious, how often our 4,400 go versus everybody else? And secondly, do they get annual physicals in a preventive care function, as opposed to they're sick or they broke something and they're going to be treated? And preventative is one of the things that I was really struck by. Frank Isley gave a presentation to the Taxpayers Association, and one of the statistics he mentioned is that comparing at least 2 zip codes in our county, there was an 11-year difference in longevity, life expectancy. 11 years. I mean, that's staggering when you think about it. And of course, we're dealing with probably the disadvantaged of that group. Then the other question I had was back to the portal users, if you could go back to that.
Yeah, so this one.
Yeah, this is the chart I was thinking about. I think it's interesting that while it seems to be.
Hi, Carly. Hi. Cute short.
Thank you.
I guess somebody's complaining about me asking questions. But it appears to be a significant correlation between the growth in Medicaid eligibility that occurred during COVID with that expansion, and then the retraction of that eligibility that occurred. That's what that green and blue line says to me.
Yeah.
And so I think your data says that there were 32,100 or so Medicaid people in our county, and now there are 22,000.
Roughly, yeah.
And so that's 10,000 people that have lost their coverage, at least in
That's the
terms of
number we've been
Medicaid.
speaking to, half of them children.
As I'm saying, some of them have found us, but there's probably an abundance of them that aren't aware that there's an opportunity for them to get,
Well, I'd say 1,000 of them have found us,
yeah.
based on your data. So I just think these are things that, the more you look at this information, the more you see how we can use it to be more precise in helping the public. So thank you for what you're doing.
Yeah.
I really appreciate it.
Thank you.
Yes, I was thinking the same thing, some questions to Michael. That the review you're providing is kind of time constrained, and so through the website, we have access to this, and then, of course, to you with other specific questions, but maybe a session down the road reviewing this and how you got there would be of benefit. So
Yeah.
You all will learn from it.
Yeah,
Very
if
nice
anyone
of
ever
you.
has any questions, I can pull more data. If you want to see something more specific, I can try and find it for you.
Well, I would like to know about
Yeah, I can
portal
look and see
users.
how frequent
Yeah.
our people are going to
Yeah.
visits. Yeah.
Michael,
The thing it spawned in my mind, or one of the things was, obviously, we picked up some of those who lost their Medicaid. What are we doing to get them all in? I don't know that there's a way to know this, but how many people try to become qualified, and they're that close, but they don't? That are, those, those underinsured. There may be some ability to pay, but they still are getting slammed. And I don't know if there's a way to know that outside of having the folks who are doing the documentation to get into the system to kind of make some kind of note, but,
Yeah,
I mean, there, again, it's just identifying who they are and trying to help those in need. I mean,
We have
that's
talked
what we're striving to.
some of the agencies about trying to get an idea of how many people are in the 200 to 300% range.
There's a way to do it.
Yeah, but a lot of them were not tracking that at
Yeah.
all, because a lot of their sliding fee was only going up to 200 anyway, so they weren't looking at it. I know a couple people said they were going to start trying to track that information, so we'll have to follow up and see where they're at with that. But I want to say a couple months ago, we did reach out, but a lot of them weren't looking at anything above 200%.
And that would inform us, at least to the point that we could have a discussion about, do we need to change any of the parameters? I mean, we can't open it up ridiculously. But if there are people in need and we're in a position we might be able to, that's something worth taking a hard look at. So thank God we've got the ones we've got. It's
Yeah.
getting better and growing, but there's a lot of people in need.
Yeah.
Michael, I will say that we, kicked around the idea of, well, what is instead of 200%, what does 250% look like? We would like to bring a suggestion to the trustees. However, guessing on a number to what the incremental
Exactly,
cost, I
yes.
can't guess on it. I want to know.
When we did that study, when we went from 150, Alan, you were on part of that, 150 to the 200%, we thought it was going to be some huge amount, and it really was not significant at all. So I would be, yeah.
Yeah. We'll see if we can dial it in and get something that's at least going to be a ballpark or a range that we feel is reasonable, and we'll present it to you to see if you feel it's reasonable, and then we could go from there.
Comes to mind, it's possible, United Way, the locally or at the state level, may have some additional, and they're doing the analysis of Alice. They may have some data that could help get us there. I hadn't thought about it really much, but it spawned the thought.
Well, thank you, Caitlin and team. And the last item on my report is an impact story I'd like to read. So this is a client of Thrive, which used to be Substance Awareness Center. I actually am committed to Thrive now. I don't say SAC accidentally, so it's been a while. When Nate arrived at Thrive, he was exhausted physically, mentally, and emotionally. After months on the streets, battling addiction and barely surviving, he knew he needed a change. He had just completed detox at Port St. Lucie Hospital, and while it was a start, he was still searching for what came next. I didn't want to feel like an animal wounded and trampled, Nate shared. I was tired of just surviving the day-to-day. At Thrive, Nate found more than a program. He found a path forward. With the support of a compassionate team and a structured environment, he began to rebuild his life piece by piece. Through day treatment services and recovery housing, Nate learned meditation, grounding techniques, and how to manage grief and trauma. He reconnected with his values, rediscovered his dignity, and built a network of support through family, friends, and Narcotics Anonymous. Thrive restored my integrity, my passion for life, and my belief that I could truly recover, he shared. Today, Nate is sober. He's also thriving, with a renewed sense of purpose and the tools to sustain his recovery. He's building a future he once thought was out of reach. Thanks to the support of the Indian River County Hospital District, Thrive's Recovery Works program continues to change lives like Nate's, offering the care, structure, and community people need to heal, grow, and thrive. And I thank Carrie for submitting that.
Excellent. Thank you very much, Frank.
Thank you, Mr. Chair.
Okay, moving on, we have semi-annual reports from 3 of our funded agencies. These are written reports only. Does anyone have any comments or questions? I do note that they're using the Indian River Hospital District report.
And I just want to be clear that by no means, we're still in the production phase of it now. We did roll out a draft a few months ago. We do need to make some refinements. We are appreciative of the feedback we're currently getting from our community partners, but there's not the expectation to use it as it is in your packet right now.
Okay.
I have a couple of questions.
Yes, sir.
Even though somebody is listening objected. One is VNA. I think it's worth noting in their report 2 things. One is that hospice is 137% of their annual budget through 6 months. Something has happened in hospice. Now, they make a comment in their comments, just saying that they've just had a lot more demand and they've been seeking it. So they've had an impact. But it also points out that there's a growth of for-profit hospice providers in Florida that's prompted increased oversight by CMS, Center for Medicare and Medicaid Services. And they're implementing, CMS is implementing new quality metrics and audit programs for greater transparency and compliance. So I'm hoping we can ask VNA to give us copies of those. I'd be very interested to see what they're trying to measure in that, and would really like to understand more about why hospice has surged the way it has. I certainly noticed it in the budget application process, but this is, I think, raises issues with me. The second thing had to do with whole family health, which incidentally, I would like to make maybe a parochial comment. In my opinion, whole family health, the VNA, Child Care Resources are remarkable organizations that help make our community better in many ways. However, I have a question about whole family health, is that I noticed that as it relates to taking care of patients, we have different categories here. For the public can't see what I'm looking at, but they got a mobile medical office, lab assistants, pharmacy assistants, behavioral health, but medical fee-for-service. And what I notice is that medical fee-for-service, which I think is the people going to see a doctor to take care of it, be treated, is only 40% of budget through 6 months. And I don't know why that is, particularly since the number of people on our database is surging by a significant percentage. So I'd be curious in getting feedback from them on that. So thank you. I just wanted to raise those items for attention.
Alan, may I comment on, your first point, if I could just give some insight there. We did meet with VNA on this topic, and they did share with us
This is on hospice, right?
excuse me,
You're
on the
talking about
hospice topic specifically. And we did see a significant increase in the number of their folks that were on hospice, which was by design. They had shifted some resources to marketing and promoting that service to get more folks into their hospice program. But when we did compare the average length of stay, so even though they have more, they're seeing a lot more folks, the average length of stay is still in line with where it should be. So there's no issue there. And your point is a real good one, and that's something that as the district trustees you need to be aware of, and I know many of you already are, is the fact that private equity is going to be gobbling up everything. They're going to be pulling together all the hospice. They're going to be pulling together all the home care. So some of these things, they present real threats to a lot of the healthcare organizations in our community that have operated, have developed relationships, referral relationships. I mean, this can go away, and for the simple reason that, if you're a larger organization, you can negotiate greater rates. I mean, they're doing it wisely, from a private equity perspective, but they're owned by investors. The model is different. And it's in some cases, I can understand how it could be seen as a threat and take care of it and take away some of our hometown community care feel. So just wanted to make those points.
And if I may add, I think the data shows that people aren't using hospice when they really should early in the illness, waiting to the end, in that the referral from physicians in River Medical Center and elsewhere is still not at the levels they think it should be, particularly early on. And so that plus the private group that you've mentioned coming in, so it's a very much changing medical environment, but a lot of room for growth, according to what Cleveland Clinic physicians say.
Speaking from experience, having worked there, with transparency, hospice still has a certificate of need in the state. And so it's critical that those numbers continue to increase to show that VNA Hospice is able to take care of the need in this community. That's different than home health care. Home health care certificate of need went away a long time ago, and therefore, there are for-profits competing with nonprofits there. But that is something that they watch closely at the state level, that certificate of need, because they are at the doors waiting to come in.
Does anyone see a need to have VNA come live for a visit, or because we're in the budgeting process, that might be an effort that would be overly reaching, I guess? And I have some of the same questions too, and one of them I was going to say we need more information from the VNA, particularly looking at what their growth plans are. Yes, Matt.
Yeah, thank you, Frank. So we've seen the increased funding request for next year, and it's appropriate with the growth that's been outlined by several speakers. My question relates to your meeting with Jennifer and with the VNA administrative staff. We talked about this a couple of meetings ago. Do they intend to come back for increased funding in this cycle?
Let me, Dr. Mackett, let me share that well, go ahead, Jenny, were you about to answer?
Go ahead.
So the process is now where in the past, when there was an increase in volume that looked like it was going to put the community partner over budget, they would come to the board and they would ask for the additional dollars. We changed the process last year where the community partner comes to Jenny and I. And as long as they're, fee for service and, justification with the volumes that they're seeing, that it demands the dollars to care for more people than they had planned, that's something that we authorize. So Jenny, can you add to that?
Yeah, that's exactly what I was going to say, but I have had that conversation with Pat Nipper already, and we are closely watching the budget now, and we will let you know when they've reached that and what we're going to have to do. Or she's projected out what she thinks she needs for the remainder of the year, but I feel like we need to take it on a invoice by invoice basis since it's fee for service.
I assume by what you meant is that's what you're going to authorize with trustee approval.
I'm sorry, Ellen?
Well, I just listened to the words you said, and I would think the trustees are going to have to approve somebody expanding their budget.
This was decided last year with the prior board seated, that if there was a situation related to an overage, it looked like there was going to be a projected overage due to volume, meaning they're caring more for the targeted folks that we're trying to care for, that Jenny and I can reconcile, look at the numbers, and then authorize the increase based on incremental volume. It's not, there's no changing to the funding agreement, there's no fundamental change in anything else. It's just, asking for another $50,000 or $100,000 because they're tracking at a 10 or 15% over volume on month 6 or month 8 or whatever it looks like it's going to be. That's what was
Okay, we can
decided
talk
last year.
about this. I view that as a trustee responsibility, at least in terms of oversight. So I'm sorry to make a comment that wouldn't be unanimous, something I should have understood beforehand, but I wasn't here last year.
Michael?
My question is related. I remember the discussion, but I'm remembering it wrongly, perhaps. And that is, if, let's stay with VNA, because hospice is expending more than that program was budgeted, but they're underspending on others. If they stay within the amount of money that we had approved for the agency as a whole, you've got the authority to do that.
That's correct. Forgive me for not.
Okay, I agree with that.
And I was going to bring it up under unfinished business. It's not like all of us, especially staff, haven't had an abundance of work to do, lots on your plate. There may be a couple, who they are, that I think I spoke last month in my report about we don't want to wait till the last minute. If you're, and you've maybe talked to them, and maybe they're falling within the total agency assessment that we gave them. But if they're not, let's get them in, let's have them tell us exactly where they're over, why they're over, what they need, so that we can deal with that and make it official.
Especially if we think there's a chance they're going to exceed their total authorized budget.
Yeah.
Then we all would certainly need to
Yeah.
discuss.
Okay.
A little different situation.
All right, so I did remember it right, thank you.
You did.
That helps.
Apologize, I didn't.
And that I would like to thank Shannon as well, since she's been here, because she's been taking the time to go through the invoices meticulously and finding where they are running a little above their average and, as well, and notifying me, and then I'm letting her know as well. I just let her know the way that we've handled this in the past, and, but to keep a keen eye on that. If I may, I don't know, I don't want to put Marie on the spot, but maybe she can answer the question that you had,
Oh, yeah, I
Alan,
see
from Whole
Maureen, but I
Family.
didn't see her come in.
Yeah, so, do you, is it okay? Dr. Cooney, is it okay if she
Yeah,
comes
I
up? Okay.
looked at her to see if, and I didn't get
Okay.
a signal back, so I didn't want to put her on the spot either, but if you'd like to come to the microphone,
Yep.
introduce yourself, Marie, and answer the questions, that's great.
Do you want Mr. Jones to reissue the question, or did you hear it?
I think I did hear the question, yes, thank you. I'm Marie Andrus, representing Whole Family Health Center. Thanks for the question. So I think two considerations of the 40%, so we're a little bit under budget on the Medicaid fee-for-service. So you might recall that last year, maybe you don't recall, but last year we were actually over budget, and because of the Medicaid, the end of the public health emergency, there were a lot of Floridians that rolled off Medicaid, and so we had so many more uninsured patients, we had to come back to the hospital district and ask for an increase. That was $275,000, excuse me, and you all approved that, and I was so very appreciative of that. So this year, I would say that we probably overshot the budget a little bit, so we're probably a little bit over on the Medicaid fee-for-service, so that's one item. The other item, though, is that we are seeing a higher no-show rate, especially this year with undocumented. And, you know, we're trying to look at strategies to help with that, but it's really very challenging. And those are really kind of the two issues that I'm seeing with being under budget at the Medicaid fee-for-service.
Yeah, thank you for that. I appreciate that.
Sure.
Okay, any other comments on the three written reports? And we can discuss for bringing those back as necessary. Okay, unfinished business? I have just one. Mr. Trustee Westcott is not here. And before the meeting yesterday, some of you received a report he had. I guess I'd call a memo regarding the funding request. And I know you commented, you thought it was excellent, both Trustee Mackett and Jones. So, and I had an opportunity to read it, and I actually thought it was well done as well, because it aligned with our district funding dollars with healthcare and provided to me, legislative authority to do what we're planning to do. So since 2018-19, when the district changed from managing a hospital to providing oversight, there appears to be a drift of mission, I think, perhaps, that we should look at, of why more agencies were funded that really are not directly related to healthcare, or at least don't have physician or other healthcare individuals who are certified overseeing what's going on. So to me, that represents a new area for discussion, and what fits with our mission and what doesn't. So I think this is, Trustee Westcott's not here, but I just thought I'd make that comment. We need to continue that discussion. Any comments from those who?
Well, yeah, I agree. And, but we're going to have differences. He said in his report that he thought we've approved almost $4 million that were, in his view, outside the scope. I added up, I get a completely different number, which is lower, but it's still noticeable. I mean, I got 2.9 million, so and then some of that is argumentative, you know, it's because well, anyway, we're going to have time to discuss this.
Yes.
So I won't belabor it now, but I agree with you. I think that's going to be a healthy, and I appreciate what Trustee Westcott did.
Exactly. Trustee Kent.
Yeah, I read it again today and brought it, because I didn't know if it was going to come up today, and I really don't want to talk about it without Paul being
Yes.
here. I think, get that out there. However,
You're going to anyway.
no, for a reason, because perhaps our attorney and/or our exec, who's too new to know, but may have the ability to research. There's not a trustee sitting here now, or I think any trustee that's ever sat here, that went out of their way to give an interpretation that very openly led to the supposed mission creep. I think I've said, as all of us have said, that pendulum swung a little bit too far, and we're in the process of trying to pull it back. It's a matter of interpretation. It's a matter of degree. I also don't think that because I've known them since I've been in town, any of the lawyers or attorneys who have sat and provided service to the trustees, who I will always look to in having to understand everything having to do with the lease and the statute. I can't believe that any of them would allow the trustees to swing wide. And it's not just when Cleveland Clinic came in. I think that there are some of the, I'll pick one that I can think of because I was involved, Mental Health Collaborative. In its earliest days, not a lot of money, but if it doesn't fit and if it was a problem, it shouldn't have been funded. There was no medical. Michael Kent was the chair of that collaborative for a couple of years, coming to ask for money. My point is, it goes back a while, so historically, it'd be taking a look at where did it start and why. But I'd also want to say, and I like Paul, I appreciate Paul, I think he's a hell of an attorney probably in the area that he does, but I know a lot of this stuff is interpretation. So I want to hear who our current attorney is, give an interpretation on this too. So I'm setting you up to do a little bit of homework, which you probably already anticipated.
Why this won't go? I've always said, I mean, the special act, the word interpretation applies. It's up to interpretation. It's wide, it's broad. It is not narrow and limited in many ways on purpose. And so, you know, it's one person's definition of health and medical services and concept of what that encompasses might be very different than the person sitting next to you. And also, you have to think about over time in the community and culture. And, I mean, think of the things just from the time 2018 to now, since we did the transaction with Cleveland Clinic to now, the things that are important for health and medical services that weren't even on our radar 7 years ago or 8 years ago. I mean, so I think it's a moving target. I don't think it's a static thing.
And
I will
things that are
provide you
going,
some research as well, but that's
Yeah.
just my comments for today.
I didn't want to extend the discussion. I just wanted to add my comments and others. I think we really need to carry this on.
no, it's a very appropriate discussion.
However, I think Karen and I and Carrie were on the district back pre-Cleveland Clinic, and we did something similar to what Paul did. Now, I'm not a lawyer, but we took and tried to parse the actual verbiage of the special act to really try to define what the limitations were. So it's not like Paul did something that's never been done before. But he might have done it in a nice, timely way, and he is a lawyer, which gives him an edge on interpretation. So, but we've had Jennifer comment on this before in the past as well. So I think it's worth continuing to review the details, and I'm glad Dr. Cooney brought it up.
Is there any other unfinished business? Any new business? Or any of our visitors, anyone else have any new business to comment or other business? Is there public comment on any of the subjects that we discussed today? Anyone? Hearing none, then I believe we can adjourn our meeting. Thank you all for attending.